What if the routine medical test you trust to keep you healthy is quietly putting you at risk of a stroke overnight? Sounds unthinkable, but I've seen it happen. I'm a neurologist with decades treating patients over 50, and I've watched healthy people blindsided by complications from tests no one warned them about. In this video, I'll uncover 7 common medical tests with hidden stroke risks and show you the exact questions to ask your doctor to stay safe. Stay with me. The information you'll hear today could save your brain or even your life. Let's start with the CT scan with contrast dye. You've probably felt that warm rush as the dye flows through, lighting up your blood vessels for clearer images. It's a powerful tool, but here's what I've learned in my practice. For those over 60, especially with high blood pressure, heart issues, or weaker kidneys, that dye can stress your system. It might spike your blood pressure or cause fragile vessels to tighten, raising stroke risk within days. A study in the Journal of Vascular and Interventional Radiology found older adults with hypertension face higher vascular complications within 72 hours of a contrast CT. I've had patients call me shaken after feeling dizzy post-scan. Their bodies pushed too far. Have you ever wondered if a test was worth it? Ask your doctor, is this scan essential? Can we use an ultrasound or skip the dye? Share your full health history. Every detail counts. Now imagine stepping onto a treadmill for an exercise stress test. Wires tracking your heart's every beat. It's designed to test your heart strength, but for seniors, it can be like revving an old engine past its limit. The sudden surge in heart rate and blood pressure can trigger irregular rhythms or stress delicate brain vessels. A 2020 American Journal of Cardiology study showed 7% of patients over 65 face serious issues during these tests, like dangerous blood pressure spikes. I've seen patients leave these tests lightheaded, a warning sign missed until it's too late. If you're not dealing with chest pain or shortness of breath, ask, do I need this stress test now? Is a nuclear stress test or resting echocardiogram safer? It's about finding what fits your body. Next, consider MRIs with contrast, those deep-diving scans that reveal hidden issues. The gadolinium dye sharpens the images, but it's a heavy metal your kidneys must flush out. After 60, kidney function slows, and if it's already compromised, that dye can linger, linked to a rare condition called nephrogenic systemic fibrosis, which stiffens skin and tissues, causing pain. A 2019 radiology study noted 5% of seniors reported stroke-like symptoms, headaches, confusion, within a week of a contrast MRI. I've had patients come to me foggy and weak post-scan, their kidneys struggling. Before agreeing, ask, can we skip the contrast? Can you check my kidney function with a GFR test first? A simple blood test can save you from trouble. Then there's the endoscopy, checking your stomach, esophagus, or colon. Sedation makes it easier, but pair that with blood thinners like aspirin, and risks creep in. Sedation can shift blood pressure and circulation, raising chances of bleeding or brain blood flow issues. A 2021 gastrointestinal endoscopy study found a rise in mini-strokes within 72 hours of sedated endoscopies in those over 65. I've had patients share stories of slurred speech days after a routine procedure, their systems caught off guard. Have you ever felt uneasy after a test but didn't know why? Ask, is this endoscopy urgent? Can we use less sedation or none at all? List every medication you're on. It could make all the difference. The carotid artery ultrasound seems like a no-brainer, a quick scan to check the vessels feeding your brain. But finding normal age-related narrowing can lead to unnecessary surgeries like stents, which carry stroke risks. A New England Journal of Medicine study showed that for symptom-free seniors, surgery often doesn't beat medication and lifestyle changes. I've guided patients who were scared into procedures after a routine scan, only to face complications they didn't need. If you feel fine, no dizziness, no weakness, ask, why this test? If we find narrowing, what's the plan? Monitoring with meds might be the smarter path. Repeated blood draws, common for those on blood thinners or with fragile veins, can also stir trouble. Each needle stick risks small clots or inflammation, subtly raising blood pressure. A 2022 Journal of Geriatric Medicine study noted minor clotting issues in seniors after frequent draws. I've seen patients feel drained after a series of tests, their bodies taxed in ways they didn't expect. Ask, can we reduce the number of draws? Are there gentler techniques? Small tweaks can protect you. Finally, high-dose chest X-rays, often used for lung or heart checks, can add up. Repeated radiation exposure causes oxidative stress, potentially harming blood vessels and raising clot risks. A 2020 Chest Journal study linked frequent high-dose X-rays to cardiovascular events in seniors with weak vessels. If suggested, ask, is this the lowest dose possible? Could an ultrasound work instead? Minimize the strain on your body. Here's the deeper truth. After 60, your body is more delicate. A test that's routine for someone younger can send ripples through your system. Ripples no brochure warns you about. I've spent years watching patients navigate these risks, their confusion palpable when a safe test leads to unexpected symptoms. Have you ever left a doctor's office questioning a procedure? Or felt off but brushed it aside? I'm here to tell you, your instincts matter. Your questions matter. You don't need to fear these tests, but you do need to challenge them. Why this test? Why now? Is there a safer way? Your doctor is your partner, not your director. Share your history, high blood pressure, kidney issues, heart conditions, past reactions. Every piece of the puzzle helps them tailor care to you. Picture this. You're sitting in that exam room, about to agree to a scan. What if you paused, took a breath, and asked one more question? That simple act could shift everything, keeping your brain, heart, and future safe. I've seen patients transform from passive to empowered, their confidence growing as they take charge. That's what I want for you. Your power lies in knowledge. Before any test, ask, is this essential? Are there alternatives? Request a kidney function test before contrast scans. If surgery is suggested, get a second opinion. You're not just a patient, you're the author of your health story. This isn't about fear, it's about freedom. Freedom to make choices that protect your future. I want you to walk into your next appointment curious, bold, ready to ask the tough questions. Share your experiences. Have you felt off after a test? Let's learn together. Subscribe to Health 365, where we uncover truths others skip. Your health is your legacy. Write it with confidence, one informed choice at a time. Thank you for watching until the end. I truly appreciate every view, like, and comment from you. If you found this content helpful, don't hesitate to share it with your friends or loved ones. Your interaction is a big motivation for me to keep creating more valuable content. If you have any questions or feedback, feel free to leave a comment. I'm always happy to hear from you.